Namaste. Welcome to part 2 of Psychoanalysis Addressing a Fiction. So far, we have covered why it is different to be dealing in the therapy room with reality or a fantasy. How fantasy can be different from the virtual world fantasy, from the inner world fantasy. We also dealt with psychoanalysis being addressing on everyday basis regarding basic fears. We went to a very profound discussion at the point where we talked about the childhood part from where the very concrete belief systems are created and which becomes very difficult to be altered later in the life. But yes, some relief can be generated. Continuing with the same discussion, welcome, sir. Namaste.
Namaste.
So we were discussing how psychotherapy can be affecting us in a different way, where we talk about fact versus fiction and how the dynamics work there in the mind.
We had just opened up the area why the fiction that we referred to, the fantasy that we referred to of early childhood, why that fantasy has such power. What is the source of that power? And it's very important to understand the source, because we are essentially trying to remove that power from the fantasy. What Freud used to say, the goal of psychoanalysis, and he said it many times in different ways, but one of the things he said is this: to convert reminiscences to remembrances. That what is loaded in the memory with lot of affect, if you can make it conscious and remove the affect from it, it becomes a harmless memory like any other memory. So how do you convert a reminiscence into a remembrance? Reminiscence is loaded with affect. Remembrance is an innocent cognitive memory. Like you had tea at 10 o'clock in the morning. It's an innocent memory. But what happened to you in that traumatic incident, it's a loaded memory. So we were talking about why the fiction of early childhood derives such power from where. And we mentioned certain things and we'll continue with it. The early childhood fantasy or fiction derives its power from some of the following things. One is the totality of experience. The mind is not dispersed into 10 other things. Two, totality of a huge amount of free affect available, because affect has not been blocked in 100 memories. It's all available. Three, the freshness of experience. Fourth, the absence of language, because language tones down the affective intensity of feelings. Five, the absence of attenuating variables like learning, experience, repeated exposure, monotony, having worked through similar experiences before, having seen something happen to somebody, or feeling assured about one's own survival in the objective real world. The internalization of the objective world outside. All of these are attenuating variables.
Can it be lack of individuation?
Yeah.
And
Right.
can it be lack of being in the pre-defensive state?
Yes. So all of this,
where the defense is not developed.
Correct. So all of this add up. Apart from it, the primal rawness and the strength of the death instinct. That also is a very important variable. The inability to contain and not having learned containment, or yet have not found good containers, and from there to learn containing.
True.
The absence of a developed knowledge base. The
Also, the physiological, neurological aspect of the limbic brain being formed prior to
correct,
the logical brain.
correct. The inability to reason out experiences,
True.
inability to separate the fantasy from fact, lack of development of certain neurological apparatus. All of this gives the power to the early life complexes. And that is the power the fiction, what we call the early life complexes or early life fantasy or fiction, it derives its power from that particular state of the childhood.
True.
And these factors contribute to that power. And later on, what happens is once you have a memory, a traumatic memory, which we call a complex. So once you have a traumatic memory in the unconscious, which we call a complex meaning an idea which is toned with affect, loaded with affect, feelings. So once you have this complex, which has two components, idea, a cognitive component, and loaded with feelings, and two together, if you call that a complex, and if you assume that like an atom, a nucleus and a space around it, where the electron orbits are there, and in between is the vacuum, but let us say there is this spherical ball kind of oversimplified image of an atom. You can have that kind of a metaphorical understanding of the complex, that there is a nucleus of an idea and loaded with feelings around it. And the feelings are associated to the idea by some sort of a magnetic force, which we don't know as yet. And in my heat model, I call it affinity. Right? That magnetic force which binds the affect to the idea.
Idea.
Right? But whatever it be, what we metaphorically oversimplified way understand is this, that there is a complex which is formed because of a trauma. And that complex, which is at the center an idea and loaded with affect. And therefore, the healing way is the nucleus, the center, the cognitive component has to be made conscious, and the affect has to be released by catharsis. Right? Now, if this is the simplified understanding of the complex, then one of the things which is very important about is this complex is the refractory nature of this complex, that these outer walls, there is a nucleus and there is an affect, and these outer walls of affect, they refract anything that tries to break in. So whether you use objective reasoning, you use exposure, whether you use an experimental setup, you use meditative techniques, somehow this thing has a refractoriness and it bounces off the attempts to penetrate into it, right, and make the idea conscious and release the affect. And it takes quite some effort in therapy before we are able to overcome the refractoriness. And this refractoriness, which we call resistance, can be of various nature. It can just be avoidance of something unpleasant, to fear of one's own emotions, fear of disintegration of one's ego, to confusion of fact and fiction, where you think that if you release this affect, the other person will know about it and attack you, or maybe 100 other reasons, including loss and attack. So there is this whole refractoriness which does not allow us to penetrate into the complex, what we call resistance. And there is a full rainbow of that resistance, which we have discussed in one of the discussions. It's titled Rainbow of Resistance. That what is it that is around it, which creates this refractoriness, that resistance, and does not allow us to pierce into the complex. So this is how the power is derived and maintained, not only derived, but maintained. Maintained by that sphere, that invisible sphere of resistance around the complex.
So talking about having a breakthrough through the walls of resistance, comes to the point where we would like to discuss the application of therapy in doing so. So what tools are used to bring about the change and healing the fiction?
Different therapies use different tools. Cognitive therapies usually use the tool of thought. Behavioral therapies use the tool of behavior. Logotherapy uses the tool of meaning. Some therapies use the tool of closure. Some therapies go feeling wise, like they will focus 2 days only on anger or only on sadness. So they use the tool of focused catharsis, focused only on one feeling. And some therapies use the two primary equipment for this healing, what I call the state and the tools. And some therapies use only tools, not the state. Take example, CBT does not create any state. It directly uses the tools. Same for REBT, same for DBT. They directly use whatever tools they have without creating any state. But psychoanalysis and hypnotherapy create a state. There is something called the frame. So in psychoanalysis, the frame is the person comes at a particular time and lies down on the couch, and the therapist sits behind, and the person reveals everything about himself. The therapist does not reveal anything about himself, and the therapy gives interventions or interpretations where necessary. So the frame of psychoanalysis creates a state in which it's easy to apply the tools of psychoanalysis. Right? Similarly, hypnotherapy creates a state of trance in which the tools are then applied. So there are some therapies which create a state, then apply the tools. Some therapies which directly apply the tools. So the creation of state and application of tools are generic approaches to heal the pathological fiction inside the mind. Apart from it, to come to specifics, psychoanalysis essentially uses the tool of analysis, insight, catharsis, internalization of a good object, the feeling of holding, the feeling of containment, both active and passive, reality acceptance. These are the generic tools which are used to deal with that fiction. And the dealing, of course, takes a long time because the resistances come up, the defenses come up. Because around that pathological memory is a complete constellation of defenses. And one of the reasons, which I forgot to say in the last answer, why we refuse to let go of those things. Freud used to say something very important. He used to say, man will let go of anything but his suffering. So it's not easy for any man to let go of his suffering. And we have dealt with it before, the joy of suffering. In the discussion on the joy of suffering, in the discussion on self-destruction, and in the discussion on masochism, why we don't let go of our suffering so easily. And there are some reasons. One reason is we just don't want to open it up because it's very painful. So we refuse to believe in the principle of short-term pain for long-term gain. The short-term pain is so intense, we just don't want to go by this principle. So the sheer unpleasantness of it, number one. Number two, there can be a masochistic joy in it. Number three, there can be a feeling of feeling special because you are suffering. A narcissistic feeling of being special. Number four, it may have to do with revenge. That you suffer in order to hurt somebody. which usually is the parents or somebody in the family. So you hurt yourself to hurt somebody else. Until the revenge is complete and done, the symptom won't go. Or the fifth is, there can be an expectation that if I'm suffering, an ideal mother will somehow come and take care of me. So there can be variety of reasons, but one reason is there can be a secret pleasure in suffering. And often the suffering is on the surface, but the pleasure is hidden. So when a long-standing chronic situation exists, there is often, more often than not, I will say, a secret pleasure which accompanies the suffering. And secretly speaking, the man does not want to let go of that pleasure. So at some level, in such cases, the pleasure and the pain, if you try to net them off, if you calculate the secret pleasure, the balance can come positive or just mildly negative. It does not come as strongly negative as we consciously think of it. So these are some of the reasons why it is not so easy to apply the state and the tools to heal the fiction. And what ISTDP tells us and psychoanalysis tells us is this, that the state in which change happens readily is a state where the crisis is created. You
Very
create a
interesting.
crisis to facilitate healing. And the crisis is created by getting the person to one by one first remove all the defenses, remove all the rationalizations, all the cognitive reasoning, and ask him to straight away focus on the affect.
Similar to the initial state where it was created, where
Correct.
these nothing rational thinking was.
And in normal life also we see that people often change, deeply change. And when does this change happen? This change happens in a crisis.
Crisis.
That
So true.
in the crisis, what happens is the mind is emptied out of everything except the problem that it's dealing with. The mind is completely focused, very, very slow in thoughts, but very deep in thoughts. And the mind has decided that the suffering is too much, I have to end it now. And I have to get into a state of no suffering, a happy state. And then the mind in such a state analyzes that what is the cause of my suffering and decides to let go. And that decision converts into action. And a fundamental restructuring of the mind happens. So when we say
somewhere this time there is a facilitator along the therapist and the therapy space, which is going to provide the container for this. While in the first place, when the pathology had started, there was nothing as such.
correct.
So
So now you have
there
a
is
container.
a possibility.
Now you have a container. You have somebody who can work through the defenses. You can have somebody who can interpret and give you what the unconscious mind is doing, and who knows the technique to facilitate creating a crisis for your own benefit, to accelerate your healing. And that healing crisis is created. And after catharsis, a fundamental restructuring happens. Otherwise, you will be in a constant state of catharsis if fundamental restructuring does not happen, because affect will keep getting bottled up, you will keep releasing it, right? It will be a constant maintenance, but that's not how it is done. What happens is after catharsis,
People are also stuck in that phase where there's a constant catharsis, seepage of all the affect
correct. So,
in the difficult pathologies.
right. So if catharsis does not lead to a restructuring, there is a possibility of relapse. And this happens in many cases where the person is not trained enough and he goes on for some workshop where you leave it at catharsis. Then the person is endlessly into this chain of workshops.
True.
And finally realizes workshop does not work. It's only a shop.
There is some relief, but there is no restructuring happening. So nothing beyond happens.
That's more accurate way of saying what I said. I went to the extreme, but you are right. There is a gain, there is a partial catharsis. There might be even a heavy catharsis, but a fundamental restructuring does not happen. So if that happens, then of course the fiction goes at the roots. Or if substantial catharsis happens and substantial restructuring happens, but not completely, then a synthium remains.
How ironical it is that we believe we are rational beings, at the same time we are slaves of our false fictions. How would you justify that?
The premise is wrong. Homo sapiens sapiens is actually Homo sapiens seculus. We are a sick species. We are not a species of wisdom. We are groping for wisdom. We are not wise by default. Thinking is a laborious and painful process, does not happen naturally to us. Not to think and be in the pleasure of inertia occurs much more naturally to us. So it requires a lot of self-training and enlightened masochism to let go of the pleasure of inertia and get into the painful process of thinking. Without enlightened masochism, we cannot do it. So if you look at an individual, he is largely in his fantasy world. And his desires are in the surreal, not in the real. Most people deal with the real only as a necessary evil. Given a choice, they would always like to live in the surreal. It's like if you ask anybody who is working 10 to 5 and getting paid, let's say, 15,000 rupees per month or 25,000 per month, which is the bulk of humanity. If you put $1 million in their account, they would not come to work even a single day.
Okay.
They accept it as a necessary evil, not that they're fond of it. The same is true of the real and the surreal. We are instinctively fond of the surreal, and we accept the real only as a necessary evil because there is no choice but to. The same is, so this is true at the individual level, that we are not creatures of reason, we are creatures of pleasure and fantasy. We embrace reason only as a necessary evil. Exceptions apart, this is the rule. The same is true at the collective level. If you look at human history, you won't find even 50 years of peace in more than 50,000 years of our history. Every 20, 25 years, you will find destruction, mindless destruction. I can understand if somebody goes to another kingdom, kills everybody and takes over the property. But what would be the point of destroying everything and then taking over that country and then spending your money to rebuild it? Or even other people who don't have money, you're trying to tax them.
Tax them. True.
So this mindless violence, mindless destruction is very much a part of our DNA. So we are not, as we would like to believe, a very peaceful, very wise, very loving and compassionate species. We are an extremely violent species.
That brings to the fact there is no light at the end of the tunnel when you say like that.
So it's this was a question which was raised by Einstein to Freud.
Okay.
During the Second World War, because both were Jews and both had many of the relatives killed by Hitler.
Right.
So both underwent a very tragic thing. In fact, Freud was to be assassinated and Hitler allowed him to go because he was so popular across the world. And he had to flee with his family to UK.
Oh yeah, right.
So this brings us to a very important point that Freud could analyze entire unconscious of Hitler but could do nothing about it. So this brings us to the difference between knowledge and power. That knowledge does not automatically translate into power. Freud could analyze Hitler's unconscious, do nothing about it. He had to flee with his family to UK. And in that course, when Einstein and Freud both saw this mindless violence, brutality, torture, this destruction, Einstein wrote a very famous letter to Freud that why human beings do this. Right? And Freud was very pessimistic about human beings. He said the instinct of domination, violence, destruction, and torture, sadism, right? They are far more powerful than the forces of wisdom, compassion, love, concern, construction. So this occasionally, what Freud would later call death instinct, it rises with such power that it throws into one corner the life instinct. And then these components of human nature, of domination, sadism, destruction, violence, that takes over. And this is why the species is a fundamentally irrational species. So,
And no wonder it creates a collective ripple of death instinct with all the suppressed and regressed people.
So in that sense, if you go from that conceptual point of view, then once the death instinct takes over, it creates fiction or fantasy or thought which allow it to manifest itself. And if you go back to the Freud's two instinct model, then the fantasy becomes a tool of the instinct of expressing itself. Right? So then there would be at the bottom the instinct, and then the fantasy, and then the thoughts. So in that sense, in that model, the thoughts and the fantasies become tools of the instinct for its manifestation. Right? And these instincts are rooted deep into our hardware. So from that conceptual point, either in the course of evolution or by genetic engineering or by appearing of a better species, can this problem be surmounted. In the Indian spirituality, there is a different approach that by some spiritual techniques and long sadhana, you can overcome these problems. You can be free from the entire grip of the death instinct, except its physical manifestation. And some schools will go to the extent of saying even you can be free from its physical manifestation. But coming back to it, the premise is wrong. Our history, our everyday, the way we treat our servants or people who work for us, the everyday brutality and the domination and the power, the naked display of power that we see. And even in international geopolitics, the ultimate arbiter is power. It is not what is morally true or intellectually true. Finally, it is who has the bigger sword.
In fact, sometimes I say it is not even about the person.
Yeah. So it tells us very clearly that if we look at individual behavior, if you look at the history and the history of conflict, if you look at geopolitics, it's very clear that we are not creatures of wisdom. We are primarily driven by irrational and unconscious motivations of power, greed, domination, violence, brutality, sadism, envy, and so on. They are far more powerful than the more sane part of us, more constructive and loving parts of us. And it takes quite some effort to alter the balance inside of us. It doesn't happen naturally, except in very few people. In large part of humanity, I would say 98% of humanity, we have to strive and work for years inside of us to overcome these hardwired difficulties. So in that sense, we are an irrational species, and psychoanalysis is a very fit science for us, the science of the irrationality.
enchanting exploration into the mysteries of the human mind. One more enriching episode. Hope you all liked it. See you all again. Namaste.
Namaste.